Hi guys, today I interviewed Leigh Asher from Babyfaceaz LLC. She talked all about Botox and Derma Fillers and what to look for in an aesthetics nurse, which is very important. Leigh was one of the first to get qualified in Botox injections. She did it back in 2003. She's been doing this for 14 years, and I can tell you she is a face artist. She is amazing. Just go to her Instagram page at Babyfaceaz LLC and you could see examples of the different type of artistry work she does on the face and the lips. She just makes women look gorgeous. So check her out. But without further ado, here's the interview. So Leigh, you are the owner of Babyfaceaz LLC and you are also a nurse. You're a business owner and you're a founding member of the American Academy of Medical Aesthetic Professionals. So what in your life shaped what you do now?
Well, I was always drawn to helping people, and that's why I went into nursing way back in 1976. And I did all different kinds of nursing, but I just didn't click with different specialties. And I came home one day and opened a journal and it said, "Learn to get Botox." And I had just gotten Botox for the first time. And I knew that was what I wanted to do.
And what year was this?
This was 2003.
Okay.
And I got on a plane and flew down to Florida to the Esthetic Skin Institute, who trained me on all the aesthetic procedures that I do. And I came back and quit my job and started my own business, and the rest is history.
Now, was that here in Arizona?
Mm-hmm.
That you, okay.
Mm-hmm.
If you can tell me, what exactly is an aesthetics nurse?
So aesthetic nursing is a specialty like neonatal or gerontology or cardiac. And the aesthetic specialty is fairly new because of all the aesthetic procedures that started in around 2003. So this specialty grew and expanded exponentially when people started getting all these procedures done. So you have to be certified and trained. You have to be a registered nurse or a doctor, a dermatologist, a plastic surgeon, or a doctor, or a naturopath to do these procedures.
Okay, so if somebody is out there advertising for Botox or filler and they're not a registered nurse, you should stay away.
Right.
Right. Gotta watch out for that.
The main thing you want to look for is experience and training.
Okay, so
you
the
have to have
qualifications are certification?
Certification and training and experience. Because everyone has the same muscles in their face, but it takes experience and training to figure out how those muscles are moving to be able to treat them properly. So Botox and filler are like math and art, science and art. That's a combination of the two.
Right, because you have to watch out for, like if somebody is, let's say, part of their lip might not move as much as the other half. Do you have to be careful? Do you have to watch for that? Or does that not matter as much as the, whether one side of the lip has less volume in and of itself before you do any filler than the other?
Well, we're all asymmetrical in some way. And so the challenge of the aesthetic nurse is to look for asymmetry. There's a lot of things we can correct with Botox and filler. And so the unconscious eye is always looking for symmetry because that is part of beauty.
Yeah, that's very true. And so what are like the 2 or 3 most common treatments you do?
Botox is number 1 still. There are 3 FDA-approved neurotoxins in the United States. They are Botox, Dysport, and Xeomin. I use all 3. They're all cousins of each other. They all work basically in the same way by stopping the muscle movement temporarily of dynamic expression lines like frown lines, forehead lines, crow's feet. Those are the 3 main areas. The second top procedure is filler, which revolumizes where in the face where we're losing volume. Mm-hmm. The temples, the cheeks, the nasolabial folds, the mouth, the chin, the jawline.
Okay, and So you decide which filler to use depending on what the person asks for when they come in to your office?
Well, there are many, many approved fillers on the market in the United States, and there's hundreds in the world. They have to be FDA approved, and it's very confusing to the consumer to try to figure out what filler goes where. So I feel like that's my job. And sometimes it's based on the price, sometimes it's based on the application, but it's really my job to figure out what is best for that face.
Yeah, that makes sense. Yeah. That's one of the reasons why. That's one of like your qualifications.
Right.
Again, so that's where the training comes in as well as experience to know
Exactly.
what would be best for each client.
So the viscosity of the fillers varies. And so you wouldn't put a real thin filler in, for example, in the cheeks where you need a little more robust product. So that's one of the factors that you would consider.
Yeah. Okay. So how are Botox and Derma Fillers not bad for us?
Botox is one of the safest drugs there is on the market. It has been used in the body for over 30, 40 years. It's used for bladder spasms. It's used in children with cerebral palsy that have contractures or spasticity. It was first discovered by cosmetic use by the Carruthers, who were testing it or using it for strabismus or lazy eye. And they discovered that the crow's feet wrinkles were going away. So that's when the cosmetic use came along, but it was used in the body safely way before that.
It's great. Because a lot of people do think that it's dangerous, but...
Well, they say it's a poison, but it really isn't. It's a
Yeah.
neurotoxin. It just stops the muscle movement temporarily.
Yeah, I think people get hung up on the word toxin.
Right.
And when...
They do.
Yeah.
Yeah.
But it's technically, it's not.
It's
correct?
very, very safe.
Yeah.
Now, fillers are manufactured in such a way that the molecular structure is the same as what's in our skin. That's why people don't have reactions to them.
Yeah.
Unless it's done improperly.
Right.
Right.
And-
But technically the molecular structure of fillers is very safe.
And I was reading about skin rejuvenation. Can you tell me like what exactly is skin rejuvenation?
Well, if you think of our skin as a little engine, and it's turning over every 28 or so days. So the skin cells die off and new cells grow through. So skin rejuvenation simply revs up that engine so that the dead skin sloughs off and the skin doesn't look dull and lifeless, and new skin shows through and looks luminous and dewy.
And so
And
what
refreshed.
procedures do you do to help somebody achieve that?
So you can do chemical peeling, which is an acid, a very safe, comfortable acid that would exfoliate the outer layer of the skin, which is called the stratum corneum. You could also do mechanical rejuvenation like microneedling. There's lasers available that rejuvenate the skin, dermaplaning, and all those procedures rejuvenate the skin. Also skincare products at home, because what we do here needs to be supported at home. So you can do a lot in the office, but if you're not supporting it with medical grade skincare products at home, then you're losing that momentum.
Everything you've done.
Right.
And so do you offer skincare products here
Yes.
for clients?
Mm-hmm.
And with regards to the chemical peels, are there different grades of chemical peels? Can most people leave here and go back to work, or do they usually wait till the next day, or how do the chemical
Most of the chemical peels I use are mid-depth,
Okay.
and they could go back to work. They might be slightly red, not like a tomato red, just slightly red. They usually start peeling on day 2 or 3, and they peel for 3 to 5 days, and within a week their skin looks great.
How bad is the peeling usually? Is it something that can be covered up, or is it like a sunburn type
No,
peeling?
it's not really a sunburn, it's flaky.
Okay.
So your skin is kind of flaking. It may be on your pillowcase, you may find it on your shoulder.
Okay.
So yeah, if you want to hide for a few days, you can, but most people work through a chemical peel. They just say, I got a peel.
Yeah. So let me ask a few questions about you and what you do personally. So what do you do to stay in shape? Because you are in wonderful shape.
Thank you. Well, I love to walk. I love nature. I have a dog. I love to walk my dog and just smell the morning smells of our desert. I like to play golf. Those are the two main things I do. I also do some Pilates and weight training. Go to the gym.
Do you walk like in the mountain preserves at all? Or?
No, I have a route at home. Okay. Yeah, I walk for about 45 minutes.
That's good. That's a good walk.
Yep.
It keeps your dog happy.
Very.
What do you do to keep your business thriving? Do you do advertisements, or is it mostly
I don't
word
really
of mouth?
advertise. 99% of my business is word of mouth. And I think the reason why is because when a client comes into me, it's my job to make sure they're taken care of. And I work with every lifestyle and budget. So if someone wants to be here once every 6 months, that's fine. If they want to come in every month, we have things we can do. It just depends on what they want. Some of them aren't even here in the summer. So it's a matter of listening to your clients and working out a treatment plan for them. It's not a cookie cutter treatment plan that I have.
And so, why do you work and live in Scottsdale? What is it about Scottsdale that you like so much?
You know, I love the desert. I love the flora and fauna. I like the lifestyle here. I love the weather. I love the restaurants. I love everything about Scottsdale.
And then you decided to have your business in Scottsdale. Was it because of the type of people that live in this area, or?
Well, I lived here first, and then got into my business. But this community, this Scottsdale, there's a strong motivation here to look good. It's kind of like East LA, but not quite.
Yeah.
So we have a lot of national events here, and there's just a strong motivation for people that want to look young for their age.
Yeah, there are a lot of beautiful people in Scottsdale.
Yeah, there are.
So what are the trends in aesthetic medicine? Like, where is it going? Where is it heading?
Well, it's certainly not going away because there's new products, fillers, treatments on the market coming around every year. It changes. It's very dynamic, first of all. That's why I always go to continuing education, because you have to stay up on what's coming around the corner. The other thing is that plastic surgery seems, the trend is that is decreasing because people are less likely to want to be cut on, and then the Botox and filler is going up because it's less invasive.
Yeah.
But it still rejuvenates the face.
Yeah. You did filler on me, and it's amazing how it made, I think it took 5 years off my life.
For sure.
Yeah. And I don't even need Botox
And you look good
here.
to start with.
Yeah, well, thank you. And, you know, I now don't even need Botox here by my eyes because the filler has helped with those wrinkles.
It does.
And it just makes a huge difference. And also my lips, filler in my lips. So I'm sort of very excited about this. And so, you know, I'm very happy to interview you and to find out more, because I think I don't know that I want a facelift.
Right.
And
Well, the thing to
so-
keep in mind is that every decade has certain things they're looking for.
Yeah.
So 20s and 30s girls, a lot of them want their lips done. Maybe they want Botox to prevent getting some lines, or maybe they want to reduce acne. Those are certain things that age group wants. 40s and 50s, they're starting to be concerned about the facial aging process. And so Botox and fillers are really popular for them. But I treat people in their 70s and 80s. So every decade has an issue, and we just customize it for them.
Yeah. So you can address every
You
single
can address
yeah.
every decade.
Yeah. Is there anything else you want to say about your business, or about anybody who's on the fence maybe about getting even just Botox?
I know there are a lot of people out there that are afraid of it, or their husbands don't want them to do it. I hear that a lot. I think it's important to be educated and to really do your research on the safety of these treatments. And consultations are free. You know, complimentary consultations can give you the education that you need to make the decision you want to make for you. I don't push people into anything. They need to be a willing client that wants to be treated. But there are a lot of people out there that are very misinformed.
Well, thank you so much for this interview, Leigh.
You're welcome.